Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. Today, I am joined with Ashlynn.
Hello.
Welcome back, Ashlynn.
Thanks.
Ashlynn's been on maternity leave for, 10 weeks-ish?
Yeah, just about 10. Henry's 12 weeks old today, so.
Oh, my gosh.
I know. Crazy. Time's flown by.
Yep.
Yeah.
So we're recording this podcast. It probably won't come out for like a month or two. I don't know. But I'm about to go on maternity leave. We're like high-fiving as we
Yeah. The ship's passing in the night.
Yeah. As you come back from maternity leave and I go on maternity leave and all good things.
Yeah.
But we thought today we could talk a little bit about ear infections because 'tis the season right now. We are in the middle of sick season and seeing lots of fun ears.
So many ears.
So many ears.
So much snot.
And I think there's a lot to ears that in some sense is very simple. And in other ways it's kind of nuanced.
Mm-hmm.
A lot of people don't understand what does it exactly mean when you say you have an ear infection or whatever. So we're gonna break it down, give you our recommendations, and go from there.
Yeah. We, obviously we want to treat an infection, but we try not to over-treat ear infections here, So, yeah, like Caroline said, it's pretty nuanced per provider.
Yep.
So,
yeah, absolutely. So I think the first thing to clear up is that let's define what an ear infection is.
Mm-hmm. Yeah.
Because it's actually can mean many different things.
Mm-hmm.
So the two main meanings it could have, I guess you could say, is outer ear infection or an inner ear infection. So tell us all about what is an outer ear infection and what does that mean?
So an outer ear infection is well known as swimmer's ear. So it's an infection of that, outer ear. I don't know how else to explain that. So not behind the tympanic membrane, but, basically the portion of the ear that you can see or that you could, theoretically touch with a Q-tip is infected. It's known as swimmer's ear because it's most commonly due to bacterial infection from water getting in the ear. So that's an outer ear infection. Typically, we just treat it with topical drops, not oral antibiotics.
And it usually presents very painful.
Very painful when you tug.
To touch.
Yeah, painful to touch. When you tug on the pinna of the ear, that little, I don't know how to describe where the pinna is.
Where you get your ears pierced.
Where you get your ears pierced. There we go. It's super painful.
Yep.
And sometimes you have some drainage coming out of the ear too.
Not usually a fever.
No fever. It's usually just isolated pain to that ear.
And, we see it more in the summer.
Right.
But that doesn't mean you can't get it in the winter too. And two, just a side note, a tympanic membrane is your eardrum.
Correct.
For all the lay people out there. You're like, what the heck is that? Okay, so that's outer ear infection. Otitis externa would be the medical term for it. And then what we're going to talk about today and really dive into is a middle ear infection or otitis media. Tell us how that typically presents in terms of just like the anatomy and what's going on in the ear.
So like Caroline said, you have your eardrum or your tympanic membrane. And what can happen is fluid, whether that's from a viral or bacterial illness, can essentially pool back there behind the tympanic membrane and like the mastoid bone, essentially. Your mastoid bone is behind your eardrum. And when that fluid just sits there, it can turn into infectious fluid or pus, essentially. So when we look at it, through an otoscope, it's white, similar to what an infected wound would look like with infectious drainage. So it's that bacteria, it still could be viral, but a bacteria producing pussy fluid back there that's then clogging that eustachian tube or the rest of the ear, essentially.
Yeah, exactly. So you've got your outer ear, your ear canal, and then the eardrum or tympanic membrane, which is a clear, you can see through it. So when someone's looking in your ear with an otoscope, what they're actually looking at is just your tympanic membrane. That's all I can see. And your ear canal, obviously.
It's like a clear balloon, essentially.
And so there is also back behind the tympanic membrane, something called the eustachian tube, that its sole purpose is to drain that fluid behind your ear. Like you should always have fluid back there, but it's continually moving. And so what happens is the eustachian tube that fluid's draining from either gets blocked because of inflammation, because of that fluid is now pussy and thick and can't drain, or anatomically, it's not in a very downward position, which happens under the age of 2. That's why you typically see ear infections under the age of 2 is because they're just anatomically set up for failure.
Right. They're just flatter than adult.
Your eustachian tube is still quite flat, and so it just a lot of times doesn't drain very well. Okay, so give us a typical progression of, this is a classic ear infection. Someone walks into the office and they describe to you their illness and everything, and you're like, I bet money without looking at that ear that you have an ear infection.
Yeah. So almost every time, I will say that some people walk in and feel fine, and we look in their ears and we're like, oh, that's, doesn't look great. But normally preceded by a viral illness. So your typical runny nose, increased congestion, could be a cough. But, and we talk about this in our fever podcast, but, we kind of, our flags kind of raise when we see a child who has a viral illness who's had a fever for longer than 5 days. So, fever is nothing to be scared about in a typical viral illness, but we do want to investigate after 5 days. So typically when we're seeing these ear infections, we see kids come in who have had just tons and tons of sinus drainage, really runny, snotty nose, difficulty sleeping, pain sometimes in the ear. Some kids will report pain in their ear. Little kids, they can't tell you, but they might start tugging on their ears, things scratching their ears, and a fever for longer than 5 days. The other presentation that we see is you've had a viral illness, you seem to get better, and then all of a sudden you spike a fever again, or your child spikes a fever again. That usually kind of raises our suspicion that now the ears are infected. You had a viral illness. You had maybe viral fluid blocking those ears, seemed to get better, and now it's turned bacterial because that fluid just couldn't drain. So those are typically the classic cases of otitis media.
Yeah, and I would say too, an ear can look quote unquote infected and meet the criteria for an infection on day 2 or 3 of a viral illness, even day 4, 4 and 5 technically, but it's actually just viral.
Exactly.
Yeah. And so that's why I'm always very weary of urgent care clinics diagnosing ear infections, is because an ear can look infected, it can look red, it can look angry, you can have a fever and snotty nose, all the things, but actually, and they'll prescribe you antibiotics. And then in 2 days, you're feeling better. But actually, it was just because you would have felt better anyways, because you're getting over a viral illness.
Right.
And so if your child is presenting on day 2 a fever and your ears look pretty terrible, I know that I'm not going to probably throw antibiotics at it because it's very likely that it's viral and it's going to resolve on its own. I want you to come back 3, 4, 5 days from now, and we want to recheck and make sure it resolves. But just know that it's unlikely to be an ear infection if everything just came on in the last 24, 48 hours.
Right. I think we talked about this, when we were talking about sinus infections, that fluid, that infectious fluid hasn't had time to turn bacterial. It takes time to kind of brew in most cases.
Yep.
Sometimes you can catch a bacterial illness, but in most cases.
In most cases. And that's, I'm always telling patients, this is what the ear looks like today. I don't know what it looked like yesterday or 2 days ago. And so it's really best practice unless you're meeting certain criteria, we can follow this over the next couple of days to see, does it resolve on its own? Does it get worse? Do we develop a fever? All the things. Because just looking at it once with a snapshot in time is not always very helpful.
Right.
Out of the context of everything else.
Mm-hmm.
Okay. Dun, 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 dun. We're going to talk a little bit about when do we prescribe antibiotics for ear infections?
Mm-hmm.
Maybe give us some criteria that we're looking for and helping guide us in terms of, this, at this point, we're pretty confident that this is bacterial.
Mm-hmm.
And just to be clear, like anytime someone says like you have an ear infection, it's bacterial, they're actually just guessing.
Right. There's no way that unless we were to aspirate the fluid with a needle through your eardrum, which we will not do.
Nope.
There's no way we actually know.
Yeah, nobody can know without sampling that fluid on a Petri dish and sending it to the lab to say, you grew bacteria. So it's all an assumption that like, this clinical pattern says like it's very likely to be bacterial at this point.
Mm-hmm.
So give us some criteria.
So when we're talking about younger kids, like under age 2, right? We want to take into account, is it 1 ear? Is it 2 ears? And that kind of helps guide us in saying, with the whole clinical picture, if it's just 1 ear, you've only been sick for a few days, your fever is not, you have a fever, but, it's relieved by Tylenol, etc. Come back in 24 to 48 hours. Let's see if that ear is better or if, now it's in the other ear. We also think about severe symptoms with a fever. So, your child is very miserable, not sleeping, fevers greater than 102 for 48 hours, severe ear pain. And again, thinking, is it 1 ear? Is it both ears? That can kind of help us decide, okay, you need antibiotics now versus waiting.
Mm-hmm.
And then sometimes we'll kind of decide, we call it watchful waiting. So we'll prescribe antibiotics. We'll say, hey, let's hold off for 24 hours. See if your child improves. If they do, you don't need to give them. If they don't, you can start them or bring them back in 24 hours. We're big on bringing ears back to recheck in a day or 2. We do that with almost every ear we see.
Yeah.
Please come back tomorrow. Yeah.
And then 2, if your child's under 6 months and getting an ear infection, which is just more uncommon,
right,
then we're going to be more likely to treat in those instances. Yeah,
totally.
Sooner. We're not as likely to kind of just write it out and watch and wait. And then 2, with older kids, it's interesting because they just present a little bit differently. And often they're coming in with something that's been like weeks.
Right.
Because they don't usually have a fever. Just on and off pain is frequently what I'll see. And then it's like, oh yeah, well, your ear's probably been like this for 2 weeks straight. But you're tolerating it. So again, very much dependent on the presentation. But yeah, high fever that's lasting longer than 48 hours. Obviously the age under the age of 2, we're going to be watching a little bit more closely. But often we're observing a lot.
Mm-hmm.
A lot of people ask about ear tubes with recurrent ear infections. We're not, we could technically do probably a whole podcast on ear tubes and the pros and cons and stuff, but just know that ear tubes aren't considered unless you've had 3 ear infections in 6 months or 4 in a year. And that means that 1 ear infection, you can go through multiple rounds of antibiotics. It still counts as 1 ear infection until that one's completely resolved. And then if 2 months later you get another one, that's another ear infection. So it does take quite a few back-to-back or, frequent ear infections before tubes are even considered by ENT.
And, ear tubes, they're tubes that they stick in your ear essentially for drainage purposes. So, as we were saying, that fluid gets stuck, pools behind the ear, and that's what causes the infection. So the idea behind the tubes is that it allows the inner ear to drain. When ear tubes are placed and another ear infection arises, we no longer have to give oral antibiotics. You can just use topical or the drops. So that's really the biggest advantage of it.
And one other thing to think about too is a ruptured tympanic membrane or a ruptured eardrum. I think a lot of people are like, anytime I mention like, oh yeah, maybe their eardrum ruptured, it's like, oh my gosh, the eardrum ruptured, And I'm like, no, it's not. It's really not a huge deal. A lot of times that presentation will look like a child who is in a lot of pain and discomfort from the ear infection. Typically, you're seeing this in you can see at any age, but like infants who can't tell you what's going on, you're like, they're just screaming, crying, fussy. And then there's some sign of relief. Like all of a sudden it's like, oh, actually, I feel much better. And now I have all this gunk coming out of my ear.
Yeah. Yeah. Lots of drainage.
Yep.
Any color drainage, really, bloody drainage.
Mm-hmm. Yeah. And it's usually they wake up in the morning a lot of times and it's like on their pillow and like kind of crusted to their face. The biggest thing with that is if you come to the clinic and we see that, we'll give you eardrops. Because it's great. It's like, oh, cool. Like we could treat this with eardrops because now we have access to the middle ear. Generally speaking, now there are exceptions, the tympanic membrane will completely heal on its own.
In most cases, it will.
Yeah. Mm-hmm. So there's no need to go see a specialist or anything. We do advise not putting anything in the ear besides something that was prescribed. So you don't want to put garlic drops or anything because it's going to then get into the inner ear, which is usually protected by the eardrum for a reason. You know, there's bones in there and special things. And then 2, not doing a lot of swimming.
Right.
You know, like submerging.
Yeah, submerging the head in water. Mm-hmm.
Okay, so let's say someone comes into the office. They've got ears that don't look great.
Mm-hmm.
They're not fully infected, but we're like, what can we do to prevent or help these ears from becoming fully infected? Or maybe you have a kid who's prone to ear infections. What would you say are some things that we recommend for those cases?
Mm-hmm. Well, I harp so hard on say nasal saline and suction or nasal rinses, nasal sprays, because that helps prevent that fluid from remaining behind the ear and helps drain everything. So, you know, older kids, adults, we can try and, we can blow our nose, obviously better than little kids. But I always say at first sign of viral illness, the first little sniffle you notice in your child, start that nasal saline irrigation, spray with suction, something to keep all of that drainage moving. I mean, I've seen it work wonders. I'll recommend the same thing. You come in after a few days of viral illness, your ears don't look wonderful. Really hit the nasal saline hard. We recommend nasal saline rinses with a syringe for, little kids. And when I say little kids, I don't know what age you typically recommend, but I usually say older than 6 months. You don't want to be doing nasal rinses on, infants, on tiny babies, but they can tolerate the nasal drops or the spray. So you can do that on little babies. So doing nasal irrigation, nasal rinses, we like xylitol. There's some really good evidence that xylitol can help decrease inflammation, drain that fluid from behind the ears.
Yeah, it has some studies in recurrent ear infections and decreasing the instances. And I mean, the evidence is limited, but still there. I think it's worthwhile. If you're going to put something up your nose, you might as well throw some xylitol in there
right.
too.
Yeah. Yeah, it can't hurt you.
Yeah.
We also recommend garlic mullein tincture. So, there's not specific evidence in using garlic mullein in acute otitis media. But what there is evidence on is the anti-inflammatory properties of garlic and the pain relieving properties of mullein. Might be saying that wrong. So you can put about a quarter dropper of the garlic tincture into your child's ear just to fill the ear canal 3 to 4 times per day. Can cut down inflammation, cut down on pain. Again, if your child has ruptured tympanic membrane, you cannot do this. You can rub the garlic tincture behind their ear, could help relieve pain. Lavender essential oil massage behind the ear or kind of in front of the ear can help relieve pain as well and promote drainage. We recommend red light therapy. There's really good evidence coming out, on red light therapy for many ailments, but you can use it in the ear. So like about 10 minutes over your child's ear, you want to keep it unless they make special ones that you can stick in the ear. But, we just have the red light boxes. So you just want to keep it 6 inches away from your child's face and, let them sit in front of the red light. Massage, try and promote drainage, eliminating sources of inflammation. So typically dairy and gluten are the big ones that produce a lot of mucus. So giving that a break for a few days. So that sounds like a lot, but all of that can be really helpful. I mean, I've seen it,
absolutely
take care of almost ear infections. So we'll tell you to do all that and then come back.
Yeah. And chiropractic care
Yeah.
can be helpful if you're breastfeeding, like just really encouraging that, just the motion of the sucking and can be really helpful. Obviously staying well hydrated. I always give caution with the garlic mullein drops. I have seen some really nasty outer ear infections.
Yeah, sure.
So I think a lot of people will think like, oh, garlic drops, like because you do want it to kind of fill the ear canal. And if you're not draining the ear canal, then you've left fluid sitting in that ear canal.
Which you do not want. Yeah.
Yeah, which you don't want. So you just want to make sure when you put it in, if you are, like some people just put one drop in for pain relief. Great, that's fine. You don't really need to worry about it. But if you're filling the ear canal with garlic, you have to drain it and make sure that it gets dry between applications, or you can create an outer ear infection on top of your inner ear infection.
Yeah, which we don't want, obviously.
No. One other thing too that I'll use, especially mostly in kids with recurrent ear infections, is called an otovent.
Yeah.
And it's this really funky little thing. They use it in Europe a lot, that you blow up a balloon with your nose.
It's easier for little kids.
Yes.
Yeah, who can't blow their nose very well.
Yeah. And so it can be tricky to get them to do it. I'd say like it's most effective or like easiest use 5 and over.
Yeah.
Like you can't get a 2-year-old usually to be able to blow that hard, but you can definitely try. But if you've got a kid who's really prone to ear infections, you just Amazon otovent. Again, it's literally a balloon you blow up with your nose to help with the pressure and just being able to push that fluid through the eustachian tube. Okay. I think the only other thing that we didn't mention was also like you can put like warm onion, warm salt pack. All of that's pain relieving more than anything. I also do recommend Motrin often.
Totally. I mean, ear infections or fluid behind the ear is painful. If you've ever had an ear infection as an adult, it is very uncomfortable.
Yep.
So if your child is miserable, give them Motrin. Totally.
Yeah, and that works for inflammation too. So it's hopefully a twofer where we're decreasing the pain and hopefully decreasing the inflammation enough that eustachian tube is not shut off anymore, hopefully, and like can drain. Awesome.
Seems like a lot, but little kids, they get viruses all the time. The less antibiotics we can expose them to under the age of 5, I mean, in their whole life, but as infants and toddlers, the better. So all of this is a lot, but I've seen it work, and it is worth it to avoid those antibiotics. Because if we do have to end up prescribing antibiotics, your child is on them for 10 days. It's a lot. It's a high dose antibiotic. So just keep that in mind. That's all we're trying to do is avoid antibiotic exposure.
Absolutely. And I think too, most effective when you're proactive, obviously.
Totally.
So again, it's hard if you don't know that your kid maybe is prone to ear infections. And 2, just giving maybe some encouragement to parents who have had kids who have gone down this road. Like sometimes it's literally structural.
Right.
Like your kid, there is no amount of nasal saline that will prevent your child, because their eustachian tubes are so dysfunctional that they end up with ear tubes, and you've had to do multiple rounds of antibiotics. Like I'm so sympathetic to any family who has to go through that, and it's a very hard road to go down. But I don't want anybody feeling guilty of like, well, if only I had done garlic drops. Like, no, that may not have been the case.
May not have worked. Yeah.
There's definitely cases that's not true. But yeah, the more proactive you can be, the more you can prevent, again, moving from that viral to bacterial. So I would say my one thing I always keep in the medicine cabinet is that xylitol nasal spray.
Oh yeah, that stuff's amazing.
Yep. My kids know when I'm coming for them. My 18-month-old currently, whenever I come near him, goes, I don't like it.
I know,
and I'm like, I know you don't like it. And then we do it this time.
I know.
Quick.
I mean, yeah, the nasal rinses are hard to do on little kids. I had a neighbor, she'd be like, can you come over and do this? Wrap them up in a little cocoon.
That's what to say. You wrap them up in a towel so their little arms are restricted.
Do it. You won't waterboard them.
No. Just lean them forward over that sink. It literally takes 5 seconds.
5 seconds. And it's very satisfying.
It is.
To see what comes out.
And I will say too, like there's tons of YouTube videos out there if you're like, what the heck is this? YouTube videos, saline nasal rinse, kids. If you have a kid who's, 4 and up, you're trying to get them to do this. I have my kids watch the YouTube videos of other kids doing it because I'm like, look, it's not just me who can do it.
Yeah.
Like, you can do it. And my boys are like, yeah, snot coming out of my nose. This is so cool. Yeah. My girls won't touch it with a 10-foot pole. I could bribe them with anything. And
They won't do it.
They won't do it.
That's funny.
But I have had patients, especially in that 2 to 3 year old range, who start asking for it.
Right. Because it gives them such relief.
Yeah. They're like, I know that when I do this, I feel better, even though I hated it to start.
Yeah. Yeah.
Okay. Well, this has been great.
Yeah.
Hopefully that's helpful to everybody out there who ever has to deal with an ear infection or, a possible ear infection. We'd love to prevent as many of them as possible.
Yes. Yeah.
So. All right. Thanks, Ashlynn, for being here.
Of course. Thanks.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.